Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing best practices for strengthening the dorsiflexors of the ankle, of which the primary muscle is the tibialis anterior, or the anterior tib, however you want to term that. Before we get too far into the exercises here, I think it's important to remember that the tibialis anterior muscle is not the only dorsiflexor of the ankle, although it does provide the greatest percent contribution to that force. There's two other muscles that are located in the anterior compartment of the lower leg. Those are the extensor digitorum longus, which extends toes 2 through 5. And then we also have the extensor hallucis longus, which extends the great toe. And while these two muscles collectively don't contribute a huge amount to dorsiflexion, I think it is worth considering those. And at the very end of this video, after we get through the meat of this, which is the tibialis anterior, I'm going to show you a really good way to strengthen the toe extension of each foot. And the reason you might want to have that in your toolbox is because some foot problems present as a tendinopathy of the toe extensors, whether it's the big toe or the other four. And part of your treatment plan may include strengthening of those muscles. So I think it's important to understand that, but those are going to be more minor. We'll cover those at the tail end of the video briefly. Let's get to the tibialis anterior, dorsiflexion. So the obvious way to strengthen dorsiflexion is either performing isometric dorsiflexion, which you can see right here. And then, of course, when that gets too easy, we might progress to banded dorsiflexion, moving through a resisted range of motion. The problem with the band setup of this, and why I like to move away from this as quickly as possible, is because I don't know if you've ever tried to have people set this up at home, but if you're really isolating dorsiflexion, the band setup is actually quite difficult. And beyond that, bands only go so far. This is a fairly strong muscle in most people. It can gain strength pretty quickly. And bands are going to run their course fairly quickly in terms of their effectiveness. Sure, you could move on to some of those thick pull-up monster bands, but what's really the point in that? We want to actually progressively overload in an easy way. And that then leads us to the first of our exercises listed right here, and that is the tibialis bar raise, or the tib bar raise. It uses this little piece of machinery that you can see here in the exercise being performed. It's called the tib bar, or the tibialis bar. It's gained popularity and notoriety on social media these days. But nevertheless, it's actually a very effective way of strengthening the tibialis anterior and progressively overloading. Now, when this exercise is performed, we want to keep a constant knee angle. I found, clinically speaking, this is actually one of the hardest things for people to master. And you don't necessarily have to have the knee at full extension. It may actually be bent a little bit, as you see right here. It's going to be different for every single person, and some of it depends on the amount of plantar flexion range of motion that people have available. But you might consider using some tactile or manual cues to hold that knee in that position if the person is struggling with it. But the nice thing about the tib bar raise is that it utilizes a full range of motion. You can get into maximum dorsiflexion, and you can also get into maximum plantar flexion. And the reason that that's important is because where is the tibialis anterior on maximum stretch? It's in maximum plantar flexion. And we know from studies on stretch-mediated hypertrophy and also having to do with strength that these parameters are most effectively improved when we take that muscle into its position of maximum stretch. In addition, if we can correspond the position of maximum stretch to the position of maximum tension on the muscle and have those in the same position, well, then we're really cooking with gas now. And so at the end range here, end range plantar flexion, we want the foot to be parallel to the floor. This is because gravity points downward perpendicular to the axis of the foot. And so gravity's effect on the foot there is going to be maximum when the foot is parallel to the floor. So the way this is being done here with my available range of motion, given a few surgeries on the ankle, this is going to put the maximum tension position equal to the maximum stretch position for the tibialis anterior. Now, like I mentioned, this exercise allows you to utilize a full range of motion, which we're going to see for the next two exercises is a little bit different. They do not allow full range of motion, and we'll talk about why that is. You really, when you're doing tib raises, you want the emphasis to be on the lengthened position, okay? Point of maximum stretch, plantar flexion. Even if you can't get up to maximum dorsiflexion on the way up, that is okay. Because, I'm extrapolating here a little bit, they've done studies with the calf muscle, so heel raises, particularly in standing. And they've looked at a few different things. So they've looked at people, so here's the heel raise, right? Okay, down here's my heel, okay? So they've looked at people going full range of motion, so maximum dorsiflexion, of course this is from the perspective of a heel raise, to plantar flexion, and they've looked at people just doing the top half of the range of motion, and what they found between those two is that the outcomes are fairly similar. But when you just do the stretched position and go up to neutral and stay in that lengthen to neutral range of motion for the muscle, you actually get better outcomes. So if you can really emphasize the lengthened position of that tibialis anterior, and even if you can't get up to maximum dorsiflexion, that is okay. And that's actually going to, by extrapolation to this muscle, going to give you superior outcomes. And the other advantage here of this exercise is that it is easy to progressively overload. I think that is a very important criterion for something being a good exercise. You've got to be able to overload it easily. And the emphasis on that is easily. All you do is you throw extra weight on the tib bar and the dorsiflexors experience greater tension. Therefore, you have progressively overloaded the movement. We don't see that ease of overload in this next exercise, number 2, the wall tibialis raise. Now this exercise, we'll see it in just a minute, but it's gained a lot of notoriety on social media. It's heavily promoted by people involved with ATG systems and protocols, and I think it's a very overrated exercise, although it does have its place in a clinical setting. If somebody has pretty weak tibialis anteriors, this can actually be a good exercise that's easy to do at home to get them out of that weakness and bring the affected side up to par with the unaffected side. But at some point, it runs its course in terms of effectiveness, kind of like the banded dorsiflexion, and you have to switch to something else. But it's worth covering because in some patient populations where that muscle is very weak from the start, this can actually be very useful. You can see that exercise right here in the clip. Now, the way this exercise is performed is you stand with your butt and upper back pinned against a wall, but your feet are not under you. They are out in front of you, where your ankles begin in a position of plantar flexion. And the further your feet are out in front of you, the more of a challenge it is because you start with more plantar flexion. And then what you're going to do, as you might guess, dorsiflex both ankles, keeping your heels pinned on the ground and elevating your mid and forefeet off the ground. And this is working the tibialis anterior muscle and a little bit of the other two as well. Now, this exercise, as I mentioned, has gained a lot of notoriety on social media because a lot of people claim that if you do this exercise, your knee pain will go away. This abolishes knee pain. You are going to be able to jump infinitely higher by doing wall tibialis raises. There is absolutely none of that substantiated by any type of scientific literature, so that is just simply not true. If you're talking about knee pain is complex. There's a lot of factors contributing to knee pain, and I doubt very highly that there's really anybody where weakness in the anterior tib muscle is 100% of the cause, okay? It may be a percent contribution in some individuals, but it's certainly not a silver bullet for knee pain, and just strengthening this muscle is not going to make you jump higher or run faster, okay? In fact, if anything, I would focus more on calves for that, which we'll be covering in another video in the near future. But I digress. Now, getting back to some of the features of this exercise, contrary to what a lot of people will tell you, it does not allow you to move through a full range of motion, okay? First of all, if you have a lot of plantar flexion range of motion, like 70, 80 degrees, if you were to start with your feet flat on the floor with 70, 80 degrees of plantar flexion, your butt is almost going to be on the floor. Okay, so unless you have limited plantar flexion range of motion, you're not going to come close to utilizing the full range of motion here, and therefore you're not putting maximal stretch on the tibialis anterior. The second thing, and this is very important to understand, and it's also a feature of the third exercise, unfortunately, is that you get what's called tibio-talar compression. So when you are on your heels with your body weight, the tibia is pushed into the talus, which makes sense. So it narrows the amount of available space in that joint. Now, what do we know about plantar flexion of the ankle? Well, plantar flexion combined with some inversion is the open pack position of the talocrural joint. So if you are pushing the talus and tibia closer together and giving a little compression there. And anyone that's done this exercise will be able, once you feel that compression, you know what I'm talking about. You're taking that joint more away from its open packed position. It's not totally closed, but it's not as open. And because it's not as open, plantar flexion range of motion is going to be inherently limited because of that. The thing about the tib bar raise is you have no compression there. So when you go into maximum plantar flexion, it is maximum plantar flexion because you're allowing the joint to be in its open packed position, which you're not allowing in a wall tib raise, especially as you move onto the heel of the foot. Okay. That being said, you have a greater emphasis on the shortened position of the muscle, which can have its place. Okay, if somebody has really significant weakness, that can be useful, and you can get some strength gains with that, for sure. No question about that. But for most people, they're going to get to a point where this exercise is just no longer effective. And part of that is also because it is difficult to progressively overload. Double leg is what most people will start with, but transitioning to single leg is easier said than done. The jump in difficulty from double leg to single leg is pretty significant. And so I think you're better off doing other exercises like the tib bar raise and even the third exercise, which you may never have seen before. I only learned about it in the last year. This is called the reverse heel raise, and it's done on a leg press. You can see the exercise right here. In fact, the mechanics of this are almost identical to a wall tibialis raise. Your heels are going to be at the top of the platform of the leg press, and you want to get your heels as close to the edge as possible without risking your foot sliding over the edge. Okay, you want to have safety here, of course, but your heels are the only point of contact on the top of the platform. That being said, your midfoot and forefoot are able to go over the edge, and this puts you in some degree of plantar flexion. And then, as you might imagine, you are going to dorsiflex the ankle, and this can pretty significantly work the tibialis anterior muscle. Now, we run into the same problem as I mentioned with the wall tibialis raise, and that's that we get that tibio-talar compression. So when we go into plantar flexion, we're not going into maximum because we are no longer as much in an open pack position of the talocurl joint. It's not closed, but it's not completely open. So that range of motion is going to be a little bit limited than what we could have with a tib bar raise. Okay, so it's going to limit that lengthened position. But I found personally that it doesn't limit it as much as the wall tibialis raise. So I kind of put the reverse heel raise in between, sort of intermediate in terms of its overall clinical effectiveness for both patients and for people just training to get the muscle stronger, for athletes. Okay. So again, greater emphasis on the shortened position of the muscle, but you do get a little bit into the lengthened, but not totally. Now, despite the fact that the wall tibialis raise and the reverse heel raise on the leg press have similar mechanics, the reverse heel raise is much easier to progressively overload because it's on a leg press. You just take the pin out, add weight. Easy. And you can do that double leg, so both ankles at the same time going into dorsiflexion, but you can also just do single leg and work purely on the affected side, the side that's presumably weaker than the other. And this is much more preferred than the wall tibialis raise, which even for somebody who has pretty good strength, that is easier said than done, especially if you're a bigger dude. Imagine one tibialis anterior, not both, one, is having to lift your entire body weight. And if you can do that, I applaud you. But it is very difficult and if not impossible for a lot of people. So what the reverse heel raise allows you to do is just lower the weight on the leg press. And you lower the weight beneath what your body weight is. And then you can progressively overload that single leg variant from there. The other benefit of the leg press is you have added stability, and greater stability means better force output through the muscles and better outcomes in terms of growing the muscle and also gaining strength. Okay? So, these are 3 exercises for strengthening the dorsiflexors, primarily tibialis anterior, but remember, they also get a little bit of extensor digitorum longus and extensor hallucis longus. Now, thinking back to what I said at the start of the video, what if I wanted to specifically go after, for strengthening, the extensor digitorum longus and or extensor hallucis longus, but not so much the tibialis anterior? Maybe one of those muscles has a tendinopathy, Maybe they're just flat out weak on one or both sides, and we think that that might be contributing to the overall presentation of the individual in front of us. Well, we want to strengthen those muscles. But we can't just do these 3 exercises, even though they assist with it, because the tibialis anterior provides the vast majority of the force. It has by far the greatest percent contribution. It's going to take over the movement, and we're not going to get adequate strengthening of those toe extensor muscles. So what we want to do is have an exercise specifically designed to go after toe extension, and I have found that this one right here is the best way to do that. So what I'm doing is I'm sitting here on the edge of a table or a bed with my hip essentially in the Faber position. That gives me easy access to that foot and ankle. I'm going to take a band and I'm going to wrap it around the top of my toes such that the side of the band that's going closest to the sole of my foot, that's where I'm really pulling hard. The side of the band that's more on the top of my foot, that's just there to hold it in place. It's just there for a little stability. I'm not really exerting any force with that hand. All the force is coming from the hand that's on the side closest to the sole of the foot, and that is pulling the toes down into flexion, putting those muscles on a little bit of a stretch. But is there a way I could get even more stretch on these muscles? Yes. These muscles cross the ankle joint. They're part of the anterior compartment of the lower leg. So the answer is plantar flexion. So as you see right here in the clip, I am in a position of ankle plantar flexion, but the ankle doesn't move. It just stays in that position. And then I'm going to, while holding the band firmly, extend the toes against that band resistance. Okay. Notice my distal interphalangeal joints are not really extending that much, and not so much in the proximal interphalangeal joints. The main extension is coming from the MTP joint. As long as at least the MTP joints are extending, that is the main thing I care about. Okay? Get those joints extending against that band resistance, and you are on your way to getting the EDL and EHL stronger. And don't forget, there's also a couple foot intrinsic muscles, the extensor digitorum brevis and extensor hallucis brevis, that are also going to get strengthened by this movement as well. And so if you have a tendinopathy in those muscles, this one might actually become important as well. So hopefully this video gave you a good, thorough understanding about what are best practices for strengthening the dorsiflexors of the ankle. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.